Hi there, welcome to my channel. My name is Tamara and I am here with something a little bit different from my usual sit down and talk. But before we get into what we're doing today, can you please subscribe? Don't just be watching these videos without subscribing. So please click the subscribe button and we'll see you on the other side. So today we are doing what I call my Preggobulary. Preggo, obviously pregnancy. Bulary, obviously taken from vocabulary. So I will be defining a number of words that we're used to using while we're pregnant. And if you're just getting pregnant for the first time, you'd like to know the meanings of these words if you don't know them already. Now, when I was trying to select the words, because obviously there are so many, I had to start with an intention. And my intention was very, very clear. I want to share only the positives. There's so many negative things and so much negativity sometimes, and especially surrounding pregnancies, that you can very easily just be so scared, so terrified, and it's like, I hope this doesn't happen. I hope this doesn't happen. So no, I will not be defining any scary words. I will not be defining anything that will make you or that will torment you at night and make you start hoping, oh gosh, please don't let that happen to me. I would only define just general words, nothing scary, nothing negative, really, just to enlighten you. Okay? Are you ready? Let's go. First word. The very first thing is implantation. Implantation. Simply put, implantation is the process in which a fertilized egg attaches itself to the lining of the uterus. Simple. Let me just give you a little bit of an explanation about how this goes down. After sexual intercourse occurs, sperm travels through the vagina, past the cervix, up into the fallopian tubes. What a journey. And that is most likely where the sperm is going to engage with an egg. When that happens, about 7 to 14 days after you've had sex, implantation occurs. And very soon, you find out you've got a bun in the oven. Clear. Number 2, gonadotropin. Woo! Woo! You know when you're kind of like, am I pregnant? Am I not pregnant? I think I'm pregnant. I've missed my period. And you go buy a pregnancy strip. If you notice, those pregnancy strips have HCG written on it, because what you're actually testing for with a pregnancy strip, like when you pass out your urine on it, is to know your HCG levels. So HCG is a hormone produced during pregnancy and it's excreted in the urine. Pretty simple. Number 3, this is pretty simple. Fetus. Fetus is actually simply the name used to refer to the baby in utero from about 8 weeks up until delivery. Number 4, Linea Nigra. Linea Nigra is the so-called black line that comes down from the center of the abdomen up or down to the top of the pubic bone. Now, in some women, it's a lot darker, like really, really dark. And some others, it's pretty faint thereabout. In Nigeria, we're kind of majorly black. Yes, we have some light-skinned women, obviously, but we have that line that comes up. Mine just started showing at about 20 weeks. Yes, that's when, because I'd been waiting for it, like, are you not coming to me this time around? But when I hit the 20-week mark, I just looked down and I noticed, like, oh, welcome, you're welcome. So that line, that's what you call Linea Nigra. Number 5, Kegel Exercises. You may have heard of Kegel exercises. They're actually these type of exercises designed to tone up the muscles in the vagina and like the perineal area. So how it's done is it's simply just like imagining that you're squeezing that place tight. Or imagine if you want to pee and you have to hold that pee. Okay, so you can hold it for a few seconds, release, hold it for a few seconds, release, and it's actually helpful to help strengthen you, tone the muscles down there, and prepare you for birth. Have you done your Kegel exercise today? Number 6, engagements. No, not the engagement ring. Engagement is also, it could also be called dropping or lightening. Now, what this means is this process through which the baby drops into the pelvic cavity in preparation for birth. It could happen 2 weeks before delivery, it could happen even 4 weeks before delivery, but you pretty much feel it when that happens because you feel a lot of pressure and you might always need to pee at very short intervals. Number 7, EDD. EDD stands for estimated dates of delivery. Simple, just as it's already explained, it's the estimated dates that your baby might be born, and this is determined based on the first day of your last menstrual cycle. Number 8, this is Lamaze. Lamaze, this technique for preparing for childbirth is based on the idea that the best way to deal with pain is through knowledge and relaxation. Simple. So the idea really is that once you know about what you're going into, just relax your mind, breathe in, breathe out, just be calm, get as much information as you can, and your coach will guide you through the entire birth process. Number 9, Braxton Hicks. Braxton Hicks is kind of like an irregular or practice contraction. It's not really the main thing, okay? And the thing with Braxton Hicks is it could come about the 8th month, and what it's doing is preparing the uterus for the real contractions. And unlike the real contractions, Braxton Hicks don't get stronger and they don't stay longer. Number 10, ventouse. Ventouse, let me give you another word that might make you know what this is. Vacuum. So ventouse is a method of assisted birth, assisted delivery, in which like a vacuum is used to pull out the baby. Probably you've gotten to the 2nd stage of labor and it's not necessarily progressing as fast as it should. And so they can bring in this method to help suction the baby out, and so the delivery can be faster. Number 11, contraction. Contractions are the strong rhythmic tightening of the uterus during labor. Now, regular contractions are strong, and what they do is they dilate the cervix and push the baby out through the birth canal. You know, we talked about Braxton Hicks. That is the false contraction, but here contraction is the main thing that's going to push the baby out. Number 12, mucus plug. Mucus plug is a gelatinous cock of mucus that's often tinted with blood that seals the opening of the uterus during pregnancy. At the start of labor, or in some cases a few weeks before the actual labor really begins, that thick, gloppy, bloody plug becomes dislodged from the cervix and passes through the vagina. It's like, that's what you get to call the bloody show, and you're like, oh, okay, I'm ready, I'm in labor. Number 13, cephalic presentation. Cephalic presentation is otherwise known as the head first presentation, and what that simply means is the head is the first to descend into the cervix, preparing you for birth. Now that's the best possible way and the most normal way really for anyone to deliver, for a woman to deliver her baby. So what it is that the baby is lying longitudinally with the head first. And most times we have a situation where it's occipital, which is the head is actually, the back of the head is facing the outside and face is facing inside. That's like the safest way to deliver your baby vaginally. Number 14. Cesarean section is a surgical procedure in which the baby is delivered through a cut in the abdomen and the uterus. And it's usually used when a woman just can't give birth vaginally. Last but not least, okay, this one is not, it's not a pregnancy like medical term or anything, but it's one thing that I don't joke with. I take it so personal during every pregnancy and generally through life. And I would like to leave that with you as we end this series. Hope. What hope simply is a feeling of expectation and a desire for something in particular to happen. What do you hope for with your pregnancy? What do you hope for with your delivery? There's so much to be afraid of, but there are also so many things to be hopeful for. Choose hope rather than fear. Until we see in my next video.